Okay, good morning, everyone. I hope you've had a good night's rest because you're gonna be full packed today. You'll be having classes until the afternoon, I guess. Um, I was tasked to conduct an orientation on clinical skills one or CMED 118. Um, yeah, Now, to start off, I would like you to go back to the concept map of the AUP COM curriculum that I shared with you last time, no, when during your freshman orientation. Um, so it kind of looks parang magulo, pero um, our your course, no, on clinical skills will be targeting this particular aspect in the outcome um, performance outcomes. So it will fall under trends in medical education, specifically enhancing your clinical and communication-based skills, as well as your professionalism, communication, and ethics. Now, the course is a year-long course. At the start, we had it per semester, but we thought that it should run the entire year because it has to have or it has to maintain continuity. So the course is 36 weeks or 108 hours or equivalent to 6 credit units. One of the things that are important to have for this particular course would be number one, to have a stable internet connection. And of course, we would like preferably for you to use a laptop instead of your Android device or phone. Pero kung wala pang laptop, then an Android device like your smartphones will do just fine. Now, our class schedule it's actually scheduled every Friday 9 to 12. However, if there are adjustments that have to be made, then your level one coordinator, Dr. Janin, will inform you ahead of time. Now, of course, during the pandemic, we will not have face-to-face communication or classes. Rather, we would be doing it virtually via Zoom. However, if face-to-face classes will resume, then we will have this class at the COM building or classroom 104. Now, what is clinical skills? It's a year-long course composed of activities for student skill development, which is vital for providing compassionate and perceptive medical care to a diverse patient clientele. Now, I underline the word compassionate there because at the onset, at the start of your learning clinical skills, it is already important for you to imbibe that particular characteristic. No, you have to show compassion to your patient and think of your patient as like a relative of yours. If you take extra care when taking care of your relative, no, you should also do that to your patient. If you take great effort to take care of your mother, your father, or your grandparents, then that should also be how you should be taking care of your patients. Okay, so what are the learning objectives for this course? We have 9. Okay, so number 1 uh, pertains to the development of appropriate attitudes. Now, this is very important because as a physician, if you start off at the wrong foot, it is very, very hard to correct or change your attitudes towards the end. Pag nasimulan na ng pangit, mahirap na pagbaguhin sa dulo. So at the start of this particular course, we are going to already imbibe or teach you or inculcate the values that physician should have, especially a physician who graduated from the AUP College of Medicine. Okay, and number 2, regard the patient as a human being. This is also very important, no? We do not look at patient as cases, no? Hindi pwedeng si patient number ganyan or si patient sa room ganon. Oh no, you have to know your patient's name and you have to address your patient by their name. Because if you treat a patient, you know the patient and treat the patient as a human being, not just a case, then you know that you will be providing the highest quality of care to your patient. Number 3, consider the biopsychosocial, cultural, economic, and spiritual makeup of all patients. Meaning, you consider a holistic approach when dealing with your patient. Number 4, after this course, you should be able to conduct satisfactory patient interviews. Then you will ask, how will we conduct patient interviews when we are doing it online? I will go to that later on. Number 5, describe normal physical examination findings. Then you will ask, sir, how will we know, or how will you teach us physical examinations when our classes will be online? I will go to that later. Number 6, develop appropriate communication behavior. Yan, pwede natin gawin yan virtually. Actually, it's quite hard, no, to communicate via Zoom. No, you have to put on extra effort to do this. I believe we will be able to at least start the ball rolling in terms of communication, appropriate communication behavior. This is very important. The attitude or the skill in communicating what very important facts, to your patient in terms of your treatment or management is very important, so that your patient will be able to make the right decision regarding the treatment. Like, for example, if a patient, you diagnosed your patient to have cancer and there are treatment options like surgery or chemotherapy, then you should be able to explain this to your patient that this is not a terminal case. For example, we caught it on time, and here are your treatment options. You can opt for surgery or chemotherapy. Now it's up to you if what you want. But personally, this is the standard treatment will be we have to go to surgery, and then the patient can decide on its own. Pero again, that is why it is important for you to be able to communicate well to your patient. Number 7, maintain professional manner. Yan. This is also important. No, a lot of doctors would say, dapat meron tayong what do you call this? We should not be too familiar with our patients. Yan. Well, I would agree with that. There should still be a professional relationship with you and your patient. That is true, no? Pero at times you can let your guard down, no? You can let your guard down, and in the office pwede siya maging patient. Outside of the office, you can still be the patient can be a friend of yours, a relative of yours. Okay? Pero when approaching your patients, for example, in a clinical setting, you should always maintain professionalism. Okay? Number 8, clarify your own values regarding health, medicine, service. Well, this is also important, especially where you will be practicing medicine. Dapat wherever you want to practice, what institution you will be practicing in, you should have the same beliefs. So at least you have to know, understand. You have to do self-reflection to be able to know your own beliefs regarding health, medicine, and service, etc. And then finally, demonstrate empathy and humane approach towards patients. Well, this is very important as well, no? Always putting yourself in the shoes of an individual. Minsan, a patient can get into your nerves. Sometimes makukulit sila, medyo aggressive sila. But if you put yourself in the shoes of your patient and understand where he is coming from, then your reaction will be different. Like, bakit parang aggressive yung patient? Yung pala, tapos naging aggressive ka rin doon sa patient mo, nagalit ka rin. Yung pala, hindi mo nalaman that the patient's father just died a few hours ago, kaya pala medyo belligerent siya, medyo mainit ang ulo, no? Nagalit ka rin sa kanya. So, showing compassion, demonstrating empathy are very important qualities that you should that you should be imbibing right now, and you should be doing right now, no? And hopefully at the end of the year, no, at least you should be starting to do that already as you deal with patients. Now, yung questions ninyo na how are you going to be taught interviewing skills and physical examination? Okay? So here are our teaching and learning strategies for CMED 118. Obviously, the number one strategy for teaching would be online lectures. Okay? So that is already a given fact, and well, that is what is being practiced not only in colleges of medicine around the world, but everywhere, no? Lahat na ng any educational institution would have to do this, no? So the bulk of your learning will be coming from lectures. So we have scheduled lecturers who would be teaching you the appropriate physical examination techniques and your interviewing. So bali ang mangyayari ganito. Um, for example, you are you are slated to take the block on cardiovascular system. Okay? Now there will be a lecturer that will be assigned to do a lecture on how to do appropriate or correct history taking for patients with cardiovascular disease. Then that same lecturer or another lecturer will conduct a lecture on the appropriate physical examination techniques specifically for patients with cardiovascular conditions. Yon. So ganun ang mangyayari nan. Now we would supplement that by giving you videos on how to perform specific physical examination techniques. I will be posting these videos dun sa MS Teams account ninyo so that before a particular lecture, you can watch the videos so that you will have an idea and so that you will understand the lecturer better, no, when he performs the physical examination technique and when she shares or he or she shares with you how to do the medical interview. Here is an example of this a particular
Next, we have
physical
tests
examination
that are going
technique.
to help you assess whether or not a patient may have appendicitis. The first of those is referred to as Rovsing sign. So what we're going to do to elicit Rovsing sign is we're using kind of a dipping motion with our hand.
Naririnig ba yon?
Yes po, Doc.
Naririnig
Yes,
yung
Doc.
video? Okay, okay.
Yes po.
Yes, Doc.
Tuloy ko lang.
It's like this, and we're applying firm pressure in the lower left quadrant of our patient. Angela, do you feel any pain there? So that's a negative Rovsing sign test. In the case of a positive test, the patient would feel pain in their right lower quadrant. Tensing that fascia will cause an inflamed appendix to be rubbed up against by the fascia, and because of the inflamed appendix, you may have actually some fascial irritation as well. So pressing down on that left side will recreate that pain. The second test that we're going to perform to test for appendicitis is referred to as psoas sign. So we are going to place our hand on the patient's right knee. And Angela, if you could just lift your leg against my resistance. Any pain or discomfort there? Okay, relax. So that's a negative sign again. For a positive sign, again, we'd be experiencing, a patient would be experiencing pain in that right lower quadrant. By flexing the leg, we're tensing the psoas muscle, and in the case of an inflamed appendix, that tension is going to further irritate the appendix and cause pain in the patient. The final test is going to require the patient to flip over onto their left side, and this is called the obturator sign. So, Angela, I'm going to borrow your leg briefly here. Just go ahead and relax. We're going to bring them into flexion at the hip, and then internal rotation of the thigh. feel any pain or discomfort? Okay. Again, that's a negative test. If we did get a positive test, the patient would again be feeling that pain, discomfort in the right lower quadrant. This time we're tensing the internal obturator muscle, and that's another muscle that lies close enough to the appendix that if the appendix is inflamed, you're going to feel that pain response there in the right lower quadrant.
Okay, so that is just one example of a video that you will be watching so that you will have an idea on how to perform the physical examination technique. Okay, so after the teacher teaches you the examination technique, then it's time for you. So he will demonstrate it or he will show a video on how to do it. Then it's time for you to do the procedure yourself. Now, you would have to do um, you we can schedule this or you can make a video of you performing the procedure on a patient. Now, your patient should be someone who is 18 years old and above and should be a member of your household and should not be who is staying in your household. Okay? Please do not invite other people to come to your house to be your patient. You choose one patient and that patient will be your patient for the rest of the semester. No, the purpose of this is to avoid, of course, if you bring someone in from the outside, well, we would like to avoid the spread of the COVID virus. So as much as possible, people in your household, immediate household, should be patients of yours. Okay? So you perform the procedure on that particular patient and then you record it and then you would send it to me and then the teacher who performed the procedure will now make corrections. If it is done online or live, then the patient or the doctor can immediately give you feedback so that you will be able to refine your technique. Okay? Ah, okay. So this is an example of that. No, see, Ed Flynn. So she made a video of her doing the procedure on, I don't know kung sino to, a class, ano ba niya to? Kapatid, maybe, no? Kapatid niya. So this is what you will be doing. Then, you'd ask me, sir, how are we going to interview patients? Well, the trend today, even in actual medical practice, is telemedicine. So, for you to be able to practice your interview skills, you will be interviewing patients online, just like what doctors do through telehealth or telemedicine. So, we will be looking for patients with a particular condition. You are 10 in the group and you will take turns asking questions to the patient to be able for you to come up with a provisional diagnosis and be able to come up with management for your patients. So this is how we will be doing this. We'll be sharing with you Zoom link. All of you will log into that particular account together with the patient, and then you will take turns doing the interview. You cannot just ask questions randomly. Dapat you talk as a group. Then you can assign people to ask the patient regarding yung, for example, yung mga personal or identifying data nila. Another one will be asking on the history of present illness. Now, if you think that kulang pa and then there are other information that you need to ask, then mag-usap kayo as a group how you'll be able to butt in to probe deeper, no? So that you will be able to come up with a very extensive history taking on the patient. Unfortunately, for telemedicine, we will not be able you will not be able to do physical examination on the patient. So this is quite challenging because you will be coming up with a diagnosis based solely on your history. But as I've said before, at the start of my orientation before, 60 to 70% of a correct diagnosis will be coming from a very good medical history. So if you do a good medical history, you will already be solving the problem 60 to 70% of the time. And then you should be also thinking of what tests you will be asking to confirm your hypothesis or your diagnosis on this patient. Okay? That is why that will be supplemented by you doing physical examination on someone in your household. Kahit hindi yung actual patient, pero at least synchronous yung history taking natin at saka physical examination, although you will not be performing the physical examination on the same patient. Okay? Now, what about assessment? How will you be assessed? Of course, in the pre-pandemic world, your assessment will be done inside the classroom in the form of a long quiz or quizzes. So, ganyan. However, because we are in a pandemic, online lahat, then your quizzes will be given online. Okay? Now, what about in clinical skills? Don't worry, no? The techniques that will be taught to you by the teacher will be supplemented by a checklist. Like for example, we have checklists for the physical examination of the nervous system. You can that same checklist will be used by your preceptors or tutors when they grade you during the OSPE, which I will explain later. Now, see, it is a step-by-step procedure na you should memorize so that when you practice on your patient, someone in the household, so that when you perform it during the examination, it will just be coming out normally or spontaneously. Okay? Now, in this particular checklist, for example, this is a checklist on performing an arterial puncture examination. So here are the procedures. First, you have to identify yourself and introduce yourself to the patient. So when you perform this, then you have to do it. Like for example, good morning po, kayo po ba? Or you can say it in Tagalog or English. You can use the British accent if you want. Bahala kayo. O ganyan. So verify the patient's identity and kayo po ba si Mr. So-and-so? Ako po si Dr. ganito-ganito at magpo-perform lang po ako ng arterial puncture check. Magpo-perform lang po ako ng arterial puncture. Kasi po kailangan natin to para ma-monitor natin yung arterial blood gases ninyo. Maghugas lang po ako ng kamay at kukunin ko lang po yung equipment bago natin perform ang procedure. And so on and so forth until you reach number 15. Okay? Now, if you did everything correctly, then the preceptor will just check or tick the PC column. Ibig sabihin, perform correctly. Pag RIC, kailangan ng reminder. Pag NP, it was not performed. Okay? And then it will be totaled and that will be your checklist score. And if you pass, then it will be indicated here. No? Then you would be informed that you passed the particular procedure. Okay? And this is usually done during the objective structured physical examination or the OSPE. Now, the OSPE is a moving examination that each station you have to perform a certain physical examination procedure per station. It would be different. You will not know what physical examination technique you will be performing. You will just know when you enter the room, and then the preceptor, like in this case, it's Dr. Palomero. Dr. Palomero or Dr. Joy will just tell you, okay, perform the physical examination of the shoulder or something like that. Then immediately, automatically, since you've studied the checklist and you practiced it well, automatically, you will be able to perform it on your patient. Ganyan. So, sabi ko, you will be moving around, right? This is a moving examination. But since we're doing it online, we cannot do that. But you will still be moving from one breakout room to another. Okay? Kasi yung tutors ninyo will be stationed per breakout room. you will be assigned into breakout rooms, and it would be the tutor who will be moving in and out of the breakout rooms to tell you what particular examination procedure you will be performing. So in a sense, it's kind of like a moving examination. It's a moving examination done virtually. Okay? So this is the aftermath of that particular Zoom first OSPE examination. And of course, it was such a relief that they were able to perform it well. Okay? Now, when you go to the second year and third year, it was not called OSPE anymore. Rather, it will be called OSCE, Objective Structured Clinical Examination, because here you will be starting to do clinical procedures. Like, for example, simulated procedure in delivering uh, a baby, ganyan, or performing an arterial puncture, uh, vein insertion, ano to, IV insertion, NGP insertion, and catheterization and stuff like that. Now, don't worry about this yet because you will be doing this next year. Okay? Perform well during the first year and you will be able to do this during your second year and then your third year. So don't worry about this yet. Concentrate muna kayo doon sa OSPE because you have to master history taking and physical examination. So this is what we used before. This is a schematic diagram of where they will be going. No? So they will be held in this area. They will go to station 1. After they perform the procedure, they will be going to station 2, station 3, station 4, and then they will be exiting and going out of the building. So that is what you will be doing during the OSCE and during the OSPE, or that was what they did before, what we did before, but now it is quite different. Okay, part of our clinical skills in AUP, the AUP COM is early clinical exposure to actual patients. So first year pa lang, unlike in other medical schools, like from the medical school I came from, we were exposed to actual patients during our second year of medical training. But here in the AUP-COM, as early as the second semester of the first year, we should be bringing you to Batangas Medical Center. But because of the pandemic, hindi siya mangyayari. So in lieu of that, instead of going there, yun na, you will be interviewing actual patients. So in effect, you will be exposed to actual patients but not in Batangas Medical Center. Okay? So this is a picture of our, ano na ba to sila? Ito yung batch na gagraduate ngayon. They will be PGIs already. This was their first exposure at Batangas Medical Center. Here are the residents who served as proctors for them during their first clinical exposure, and you can see the excitement ganon in their faces, no, because they were able to go to Batangas Medical Center. Unfortunately, will not be able to do that yet. Just hope and pray that somehow we will be able to control this pandemic and can have limited face-to-face exposure so that you can visit Batangas Medical Center in the future. Okay? Now, let me show you how you will be graded, the breakdown of the grading system. So, basically, you will have continuous assessment and your OSPE. Now, 40% of your grade will be coming from continuous assessment, which includes your quizzes, your online patient interviews, and your self-analysis. Although, ma'am, your lecturer this afternoon, Dr. Joyce T. Orbe, she will be your lecturer this afternoon, will be telling you what project she will be asking you to do in lieu of the actual or the self-analysis. However, you will be graded for that. So that will constitute 40% of your grades. So when we have long quizzes or short quizzes, you have to do your best so that you'll get the 15% coming from the quizzes. And then we will have two OSPEs. One OSPE for the first semester and one for the second semester. O ganito, huwag masyadong kakabahan. Kasi yung sa OSPE natin for the first semester will only cover will cover the topics only for that particular SEM. Yung OSPE sa second semester will only cover the topics for the second semester and will not include the topics from the first semester. So, medyo mababawasan kailangan ninyong i-master. But look at the yung percentage of the grade that will be taken from your OSPE. It is around 30% of your grade. That is why you have to, master the physical examination technique. You have to practice it so that it comes out automatically. Hindi mo na naiisip, so that kapag pinerform mo siya during the OSPE, you will receive the highest marks and you will receive a good grade in clinical skills. Okay? So here are the course topics for this semester. We would be starting first with CMED 118 to 113, or the first 9 weeks. And all of these topics will be about values and attitude formation. No? The first 3 pala will values and attitude formation. The fourth one will be, or the third one will be the art of history taking. So here you will be introduced to how do you do the physical examining, the history, how to conduct medical history on the patient. Then you will be taught how to do a cursory or a preliminary physical examination of your patient. So this will be a top-to-down physical examination so that you will have an idea on how it is really done. Then you will be taught how to do an initial clinical impression, meaning after interviewing your patient and doing a physical examination, then you should be able to come up with an initial impression, or what do you think is this patient suffering from, or what do you think is the disease of this patient after performing all of that. Then for CMED 114, this is block 114, or weeks 10 to 11, you will now be performing or having lectures on history taking for that particular organ system. So for CMED 114, it's the musculoskeletal system. So you will be taught how to do a history on patients with musculoskeletal diseases, and you'll be asked to perform, or you'll be taught to perform physical examination techniques on the musculoskeletal system. Now, for CMED 115, which is the neuro block, then you would be taught how to do a history and physical examination on neuro patients, or for the new neurologic system that will run from weeks 12 to 15. And then finally, for weeks 16 to 18, which is CMED 116, or the ENT block, then you will be taught how to do a history and physical examination on these organ systems, or on a patient with eyes, ears, nose, or throat condition. Okay, so your resources. You can access our textbook online when you log into the John Lawrence Detwiler Library website. And when you log into that website, just click on Knowledge Base and then click on the steps in searching ebooks in the OPAC. So here it will guide you on how to be able to access online materials. But for our case, in clinical skills, our textbook will be Bates physical examination techniques. Okay? So that will be our textbook. However, you can use other textbooks to supplement, pero mostly we'll be using Bates. You can download chapters from the book, no? You just follow these particular steps so that you'll be able to download the chapters for the book, and then you can print it and then read it in your convenience. Okay, so that is in essence, that is what you will be doing this semester. The floor is open for any questions or clarifications regarding CMED 118. By the way, my assistant for CMED 118 is Dr. Lexan Cordial. So we will be taking turns in handling this particular block. So if you have questions as well, you can also direct it to her. She's not with us right now, but sometime soon you will also see her as she performs or she helps in managing this particular block. Okay? Questions? Ano oras na ba? Meron pa tayong a few minutes. Sige. And yes, si Jeremy ba to? Jeremy.
Yes po. Hi, Doc. Tatanong ko lang
Hello.
po kung may need na any apparatus for OSPE. Ganon.
Yes, very good. Okay. We suggest that you start to procure the basic equipment. No, what are these basic equipment? Of course, you have to have a stethoscope. You have to have a sphygmomanometer. You have to have a thermometer. But now, maybe you should be buying yung digital thermometer. You should also start procuring yung diagnostic set. Yung diagnostic set is composed of the ophthalmoscope at saka yung otoscope. Okay? You should also have a pen light with you, and you should be also purchasing a neuro hammer. So these are the basic things that you should be having. I will post the equipment that you will be needing so that you can, if you don't want to buy, you can borrow. No? Kasi sa ano nyo pa lang naman sa bahay nyo lang naman gagawin yung mga physical examination techniques. If you have someone older than you who have gone to medical school, kahit luma na yan, walang problema. If your parents have this equipment already in the house, then you can use that particular equipment. Okay? Other questions? So medyo clear ba kayo doon sa gagawin natin? Parang medyo napipicture nyo ba kung anong mangyayari sa buhay ninyo dito sa clinical skills? Yes. Kasi I want this to be clear kasi para hindi kayo. So bale magko-coincide yung yes, ito si Chanel. Tama ba? Chanel.
Hello po.
Yes, hello.
Paano po pagka wala po akong kasama sa bahay?
Saan ka nakatira?
Sa San Pablo po, Laguna.
Pero ano to? Parang nasa dorm ka?
Hindi po. Sa bahay po talaga ako. Parang aalis po kasi yung kapatid ko. Babalik po siya ng AUP. And then yung mom ko po, busy po siya lagi.
Gawan mo na lang paraan na mag-identify ng isang patient or isang tao na less ang exposure sa labas.
Okay po.
Basta ang goal lang talaga naman nun is for you to prevent you from getting infected with the COVID virus. So as much as possible, someone that you are familiar with who stays in your household para less chances of transmission. Pero kung wala talaga, less risky na lang na tao.
Okay
hanapin mo na lang. Pero just stick with that. Ano? Yeah.
Pagka wala po talaga, pwede po bang kahit parang stuffed toy or kailangan po talaga tao?
Kasi mahirap kasi ko yung stuffed toy dun sa sa mga ophthalmoscope, yung sisilipin yung tenga, ganun
Oo.
Diba? So, pero kung walang-wala talaga, sige, pwede na rin naman at least yung paggalaw mo, no? Yung technique ng paggalaw. Although hindi mo makikita yung actual, sige na lang din. Pag nag-face to face, then makikita na rin natin. So, makikita niyo siya. Okay? Sige. Si Lindell.
Hello po, good morning, Doc.
Hello, good
Ang
morning.
question ko lang po, regarding patient din po, Doc.
Mm.
Kasi po sa bahay po, ang kasama ko po dito is yung lola ko who is 90 years old. She is hypertensive with diabetes din po. So, okay
Oy,
lang po
very
ba?
good.
Okay lang po
No,
ba
not
yun,
very
Doc?
good. Oo, hindi very good na may sakit siya, pero
Abo.
at may patient ka na pala dyan, may
Okay
real
po, sige
patient.
po.
Okay yan. Basta pumayag, basta stable si Lola, like okay naman yung blood pressure niya when you perform the physical examination, stable yung kanyang sugar, blood sugar, ganyan. And then, payag siyang maging patient, yun. Pero
Apo.
pag hindi payag, wag pipilitin si Lola. Hanap na lang tayo ng iba pang next na
Okay.
less risky.
Thank you po, Doc.
Thank you. Thank you. Sige, si Angelica.
Yes, Doc. Ang question ko rin po is regarding the patient.
Mm.
Do you have preferred gender po ba ng patient namin?
Kung member of the family naman, walang problema kung babae or lalaki. Kasi hindi pa naman tayo magpo-perform ng invasive physical examination technique like breast examination. Kapag breast examination, talaga mukhang model na lang gagamitin natin. Pillow na lang siguro papagawa natin. Basta papapractice lang yung movement. Pero it doesn't matter kung male or female as long as meron consent siya to be a patient. No? Walang pilitan dito mga kapatid ha. Yun.
Okay, thank you, Doc.
Okay. Sige, sino pa? Yes. Ano to? Cedric ba to? Cedric?
Yes po, Doc. Good morning po, Doc.
Good morning.
Lagi po bang live yung OSPE po natin o there will be time po na mag-synchronous po? Like recorded video po yung isa-send namin sa inyo?
May times na recorded, may times na synchronous. Lalo na medyo critical yung physical examination technique. No? So, pag medyo easy-easy lang naman, pwedeng recorded na. But we will inform you ahead of time so that you will know what to do.
Thank you po.
Okay. Si Alexandra.
Kahit Alex lang po.
Alex, sorry, Alex. Okay.
Confirm lang po namin yung attire pag magsisend ng video or pag magko-conduct ng live exam.
I don't know if Dr. Janen told you already about you having to have your yung scrub suit. Magpapagawa na ba kayo ng scrub suit? Yan, oo. So habang wala pa yung scrub suit, any decent na na clothing, white shirt, jeans, okay lang yan. Pero once na available na yung scrub suit, when we will be having the class or when you will be performing it, you should be wearing the scrub suit. Okay?
Thank you po.
Okay, sige. Thank you, Alex. Meron pa po mga question. Ngayon na po kayo magtanong or forever hold your peace. Ay, hindi naman. Pero pwede pa rin kayo magtanong.
Hi, Doc.
Yes.
Regarding sa scrubs, pag may existing scrubs na like from, I worked before kasi, Doc, pwede po bang gamitin yan or need ba talaga magpagawa ng bago?
Well, you have to talk to Dr. Janen about it. Kung require ni Dr. Janen na lahat kayo ay kasi gagamitin nyo rin naman yan when pag halimbawa, nagkaroon na tayo ng face-to-face, gagamitin nyo na rin naman yung scrub suit na yon. Pero for now, since wala pang scrub suit, if you have your own scrub suits right now and you're comfortable using them, then you can use your own scrub suit in the meantime.
Okay po, Doc. Thank you.
Okay? Sige.
Doc?
Yes, meron pa. Sino yun?
Rualias po.
Okay, Sheila. Yes.
Doc. White coat po, Doc. Pwede na ba po?
White coat? O pwede din. Para feel na doktor. Kung gusto mong naka-white coat ka mag-interview,
Hindi pa po ako
pwede rin.
nakapag-end ng scrub. Hindi pa
Okay.
po kasi
Pero meron na
inaano
kayong
sa
white.
amin nung admission. Hindi pa pinapatay.
Okay. Yeah, if you have your white coat, sige, pwede na yun. Mas maganda nga yun para...
Thank you, Doc.
Sige. Yes, si Gfer? Ano tama ba?
Yes po, Gfer po. Hello
Okay,
po.
Gfer.
Doc, paano po pag in the middle ng SEM nag-quit yung patient mo?
Sabihin mo sa patient, sa start pa lang, walang iwanan to ha. sabihin mo na gano'n. Hindi, pero ano na lang, kung nag-quit siya, inform nyo na lang siya ahead of time na sabihin mo, this is will be needing your services for 1 semester. Sana you'd stick with me for 1 semester. Pero kung sinabi niya, baka alanganin, hindi ko sure, then you already plan for a second patient. Basta you choose someone na hindi masyadong exposed sa labas. Kasi ayaw namin na mabalita na, uy, nagkasakit yung medical student dahil yung ginamit ng patient, nandun kapitbahay nila, kinuha niya, tapos yung pala, asymptomatic COVID patient pala, nahawa siya, nahawa yung buong pamilya, ay ayaw naman namin ng ganun, di ba? Kaya as much as possible, someone staying, kung meron kayong malaking mannequin dyan, meron bang ganun? Malaking mannequin, o malaking doll, o pwede rin naman yun na, pagpapraktisan, pero mas maganda kung tao na pagpapraktisan natin or magiging patient natin. Okay? Gifer?
Thank you po.
Okay. May iba pang question? So, clear sa inyo yun ha? Bale, ang natin, our physical exam or your clinical skills will be synchronous with the block or the module that you will be having. Kapag musculoskeletal yan, your history and physical examination will be all on the musculoskeletal system. If you are in the respiratory system, ang physical examination and history taken ninyo would be on the respiratory system. Pero sa start pa lang, ililecture na ni Dr. J at iperform na niya sa inyo yung physical examination sa buong body para makikita nyo na kung paano yung takbo niyo noon. May idea kayo kung paano. Pero pagdating sa block, parang mas hihimay-himayin yun. No? Hihimay-himayin yun para makita nyo yung nitty-gritty on doing the history and physical examination on that particular organ system. Okay? Ay, teka, may mga sa chat. Okay, Doc, paano po pag wala ako kasama sa bahay? Lagi pag
Okay na po yan, Doc.
Ay, yan ba? Ikaw ba yan?
Opo.
Sige. Sorry. Okay. Okay. Nasagot ko na yata lahat ng mga... May tanong pa ba si Gifer? Nakataas pa yung kamay mo?
Sorry po. Wala na po.
Okay. Sige. Okay, wala na pala. O, meron pa ba? Meron pa Doc, mag-ABG po kami. Oo, mag-ABG po kayo. Pero sa second year pa. Hindi pa. Sa first year, puro normal ang physical examination. Pag second year, mga techniques na yan. Mag-IV insertion na kayo. Pag-pray natin na maging okay na para doon na natin gagawin yun sa AUP para mag-injeksyonan tayo doon. Di ba? Injection sa kabila, IV sa kabila, insert dito, insert doon. Di ba? So, pag-pray natin, matapos na itong pandemic. Yes! Okay. Si David. Yes, David. By the way, do we have foreign students in the class? No foreign students? Okay, sige.
안녕하세요.
Yes, Sir David.
Dok, tanong ko lang po, kami po ba yung magtutusukan sa isa't isa sa arterial blood? Kasi di po ba sobrang sakit?
Hindi. Meron tayong simulate, meron tayong ABG arm sa AUP doon sa natin. Tsaka sa venipuncture meron din, pero yung final ay on a patient yon. Ang ginagawa namin is during practice, pagpa-practicean natin yung arm. Mag-injure. Kasi kahit magkamali ka doon, okay lang. Pero yung final, yung students would choose a patient. Any student from AUP who is willing to volunteer. Yan. Yung iba, mag-classmate, sila na rin injectionan mo ako, injectionan kita. Pag masakit ang injection mo sa akin, masakit din yung injection ko sa'yo. Parang ganun. Hindi. Pero ganun ang nangyayari. Pero practice-wise, you have to practice with a simulated equipment first before doing the actual procedure. Ay, katulad yung sa picture kanina, yung si Dr. Chua performing yung pagpapadeliver ng baby. Nung time namin, yung practice namin doon is actual delivery of the baby. Muntik ko pa nga ma-drop yung baby. So, ito, papracticein nyo muna doon sa mannequin. ganun, paano maghila, tuturuan kayo ng Dr. Janet, paano mag-cut ng cord, sasaluhin, irarap, lalagay sa yun. So, para pagdating nyo sa hospital, may idea na kayo kung paano gawin. Okay? Oh, meron pa bang question? Going once? Meron pa sa chat. Wala na. Going twice? Okay, sige. So, if you have questions, itatype ko na lang siguro sa chat box. This is my email address.
Reminder lang po.
Yes.
Magpapa-class pick po. Every class kasi nagka-class pick talaga.
Okay, sige, sure. So, I posted my email address in the chat box if you have other questions, or if you have questions not pertaining to the CMED118, pwede rin naman, you can email me in this email address. Okay? So, sige. I think that would be all. Enjoy your day. God bless everyone.
Pwede po mag-stop sharing. Ayan. Okay. Ready, guys? Pa-on na lang ng camera. Yan. Okay. 1, 2, 3, smile. Next stage. Next week, si Sai na yung gagawa. 1, 2, 3, smile. Thank you.
Okay. So, out na ako, ha? May class pa kayo after this?
Wala po.
Wala.
ISP po.
ISP daw.
ISP. So, ayusin nyo na yung ano nyo, ha? Yung reaction. Na-check ko. May call lang pang ilang mga tao. Habulin nyo before 12 o'clock, ha? So, ingat. Bye-bye.
Thank you
Thank you
po.
po, Doc.
Thank you po.
Thank you, Doc.
Again
Thank you
po.
po, Doc.
Bye, guys.
Magilid.